Here's part 2 of chapter 33, and we're going to look at a few of the benign growth or proliferative conditions that can develop. The first is going to be leiomyomas. These are sometimes called uterine fibroids, and here you can see this abnormal tissue here inside the uterine wall. It's almost a wart-like material or has a wart-like appearance to it. And what this are benign tumors of smooth muscle cells in the myometrium. This is a uterus removed by hysterectomy or through a hysterectomy, and you can see these leiomyomas, right? Distorts the uterus tissue. And what results when these form is that the uterus can have abnormal bleeding, disrupts the normal function of the uterus. There can be extreme pain that is involved. The pain can worsen during menstruation, and there can also be symptoms related to pressure on nearby structures. So, for instance, probably this guy here, up here, this guy here, that can push out and put pressure on, say, the intestines or any other organ in the pelvic region at the base of the peritoneum cavity. Alright, and then the next state is going to be endometriosis. This is figure 3314. And what endometriosis is the presence of functioning endometrial tissue outside of the uterus, sometimes referred to as implants. And I don't know why, but these, what this picture shows me or looks like are little ants or pieces of coffee grounds. But what all of this black is supposed to represent is endometrial tissue, right, that should be in the uterus, that has somehow migrated out of the uterus and found its home in different areas of the body. And it's still uterine tissue, and so it's still going to respond to the hormones that are normally being produced. And so you think about the uterus that undergoes normal menstrual function, and at a particular point in the female cycle will start to bleed during the period. All right, these other places, locations of endometrial tissue can also respond to that. So here you have endometriosis of the cervix, and so during the later phase of the menstrual cycle, this area can start to become enlarged and filled with blood, just like the uterus will become. And so then, say, with intercourse and just the physical interaction of intercourse, right, then you can have tearing or opening of that endometrial material. So you can have blood during intercourse. It can move into the intestines, and so then you can have pain during defecation and sometimes even bloody stools. And then wherever this or the endometrial tissue leaves, you can also have similar activity, whether that be bleeding or pain. Alright, way to treat this, sometimes prescription oral contraceptives can be used to try to control the hormone activity and try to control the endometrial activity of this of the implants. Sometimes a hysterectomy, a full hysterectomy, where you have removal of the ovaries to minimize the hormone stimulation of these implants. Alright, and then cancer. We're going to talk about a couple of different types of cancers, specifically within the female first. Cervical cancer, almost always, and that almost always number is roughly between 85 and 95%, depending on what source you look at, almost always associated with human papillomaviral infection. So, with that human papillomavirus infection, you have high-grade dysplasia that then turns into cancer. And it's tough because particularly certain strains of the HPV, the human papillomavirus, act as carcinogens. All right, there are specific proteins within the virus that are more associated with the development of cancer. And what these cancers do is simply interfere with the activity of tumor suppressor proteins. And so even though our body naturally has tumor suppressor proteins to try to minimize cells from becoming cancerous, if you have viral transformation or transduction, then the host tumor suppressor proteins are not functioning, and so then if there is a rogue cell, that can take off and become cancerous. Right? Other risk factors include multiple sexual partners, young age at first sexual intercourse, high parity, immunosuppression, oral contraceptives, use of nicotine. A lot of times with these multiple sexual partners, young age at first sexual intercourse, really that is increasing your likelihood of contracting different HPV viruses. Alright, so cervical cancer generally has a slow progression. That's why it's important that sexually active women undergo pap smears frequently, and that word frequently used to mean every year, but now I think really the rule of thumb is leaning more towards every 2 to 3 years instead of every year, unless for some reason you're in a high-risk group. Alright, the reason it's good to have those pap smears is because cervical cancer is predominantly asymptomatic. Test for HPV, and then if you come back positive for HPV, then you're going to be in a high-risk category, and then definitely probably have those pap smears yearly. And treatment is based on really the extent of the lesion, right? Whether or not it actually become cancerous, whether or not there's any evidence of metastases. Alright, then ovarian cancer. Responsible for more deaths than all other gynecological malignancies combined for the females. Risk factors, or your risk for ovarian cancer is going to be reducing having factors that suppress ovulation. Right, there's usually no early symptoms, and generally the cancer is going to be quite advanced when caught. And so that's why it's up here with responsible for more deaths, because there's not a good way to screen for ovarian cancer. A lot of times it's just going to be based on history, patient history. And then treatment, surgery to remove the tumors, and other types of treatments such as chemotherapy. Alright, breast cancer, you have a discussion forum on this for week, whatever week we're in, 10 or 11, goodness. Most frequently diagnosed cancer in women, leading cause of death in women ages 40 to 44, and the risk is related to timing, duration, pattern of exposures in terms of exposures to the different components that are going to, different risk factors for developing breast cancer. Alright, so hormones influence the risk of developing breast cancer, without a doubt. There's a lot of different things that will play a role in your risk of developing breast cancer, but physicians, scientists know that there are flat out 6 factors that affect the risk of breast cancer. Right, and for a long time it's been known that the earlier a female gets pregnant, has her first pregnancy, that's going to be a protective effect of to avoid developing breast cancer. And the reason for that is, if you remember with cancer, you have cells that are going rogue, cells that are developing mutations that become harmful. And so with pregnancy, there are a lot of physical changes that go on in the female's body. Right? Anyone who's been pregnant understands that, knows that very well. And it's not just the uterus, it's going to be a lot of different systems, including the breasts. And so what happens is you have those changes in the breast tissue, and even though the breast will generally become enlarged, a lot of the cells that were there initially prior to pregnancy get sloughed off in that process. And so if you've had a cell that has developed mutations very early in the process, or very early in, say age 15, and then if a person gets pregnant at age 20 or 21, then they're going to get rid of that cell that acquired the mutation at age 15, and it is no longer there to develop additional mutations. Alright, protective effect of removal of the ovaries and the pituitary gland, that doesn't happen as often. But again, looking at the hormone influence, right? Pulling out those ovaries, you decrease the hormone exposure. Increased risk associated with early menarche, late menopause, nulliparity, and your discussion forum this week talks about that early menarche and the late menopause. So the length a woman is actively having menstrual cycles, having that normal production of hormone, is actually problematic because there's a longer time frame in which the body's tissues are receiving signals from those hormones. All right, relationship between different types of fat, free estrogen levels, oxidative changes in estrogen metabolism, hormone-dependent development and differentiation of mammary gland structures, and then efficacy of anti-hormone therapies for treatment and prevention of breast cancer. Again, using treatment that is going to target hormones. Alright, so manifestations of breast cancer, painless lump, palpable nodes, dimpling of skin, edema, bone pain. That bone pain is generally going to be an indicator of metastases. Surgery based on the stage of cancer, surgery, radiation, chemotherapy, hormone therapy, different biological therapy that's going to specifically target the tumor. And then this is an interesting figure, unfortunately, really, looking at the age of breast cancer. And up here you see this almost linear line for the United States of developing breast cancer. After the age of 40, really, you start to increase your risk of developing breast cancer by quite a bit. Japan and China maintain relatively low levels of developing breast cancer.